Hi, I'm Dr. Lee. This is Regenesis Stem Cell Center. I'd like to talk to you a moment today about birth tissue products and supposed stem cells from birth tissue products. You see what we have up above is basically a placenta, an umbilical cord, a fetus, and the surrounding amniotic membrane with amniotic fluid. Specifically, let's talk about amniotic fluid today. So you have a lot of companies and a lot of clinics that push this amniotic fluid as stem cell therapy. There's been a lot of studies done on it. The Interventional Orthopedic Foundation has placed a position statement on these birth tissue products, and basically they've yet to find living cells capable of biological activity after they've been frozen and thawed, and that goes for the amniotic fluid. It goes for the umbilical cord Wharton's jelly and the placental tissue. And in fact, I've had a little bit of experience. I had one lady that wanted the placental tissue injected. She ordered some, and the rep actually brought it here. Once I opened it and got a whiff of it, I bailed on it. It was not anything that I felt comfortable injecting. A true stem cell therapy, though, as allowed by the FDA, comes from your own bone marrow. It can come from fatty tissue, and I've used fatty tissue exclusively in the past. I've gotten away from it now because the FDA has decided that using a enzymatic digestion of that adipose tissue to release the stem cells is more than minimal manipulation. So I don't do it. What I do is a bone marrow aspiration, and I offered both of those for a period of about a year. Patients could take their pick, whichever one they wanted. And much to my amazement, the bone marrow aspiration actually had exceedingly good results with osteoarthritis and for some other studies that I participated in. So now I've got to where I just do the bone marrow aspiration by itself, and it is the gold standard procedure that we do here at Regenesis of bone marrow, and also we do platelet-rich plasma in conjunction to that. We also use fluoroscopy and ultrasound for our diagnosis, for the injections. Close is not good enough with stem cell therapy. Samantha here gets very frustrated with some of these birth tissue pushers, and the problem is, you draw up a frozen sample out of a little vial, and you think you're a stem cell doctor, and you start injecting it. You don't have an ultrasound, you don't have no clue where they're injecting it at, but yet they're stem cell doctors, and they charge patients stem cell prices for it. I mean, a stem cell procedure lasts about 3.5 hours. It takes a long time. We have to prep these patients. We have to do labs on them. We have to get diagnosis. We do an MRI quite frequently, x-rays, and then optimize their health before we do the procedure. Then we do a procedure on them, and we follow them up at 1, 3, and 6 months. It's not just squirt something and go and call it stem cells, and we see this quite frequently at chiropractic clinics. In Alabama, they'll hire a doc that'll come over and do the injection because they can't get nurse practitioners to do it here in this state. But they'll inject amniotic fluid, they'll inject Wharton's jelly from the umbilical cord, they call it stem cells, charge $5, $10. I had one patient bring me a full-page brochure from Tennessee Regenerative Medicine that came on a dog and pony show here and was wanting to charge him $20,000 to go to Chattanooga and have a Wharton's jelly stem cell, quote-unquote stem cell, fake stem cell product injected for neuropathy. $20,000, guys. It's ridiculous. It's over the top. So if you really want to know more, come to Regenesis Stem Cell Center, take a look and see what real stem cell therapy is.